On behalf of UCLA Health, congratulations! Please take a few moments to review this helpful information about caring for yourself and your baby. The perineum is the space between the rectum and your vulva. Perineal care is important after a vaginal delivery, especially if you have stitches. To help prevent infection and increase comfort, cleanse the perineal area from front to back each time you urinate or have a bowel movement. You may continue to use the peri bottle you used in the hospital. Apply a clean peri pad each time you use the bathroom. Apply numbing spray or cream to your perineal area as recommended by your healthcare provider. We don't encourage traditional baths while you're healing, but you may enjoy a warm sitz bath several times a day for comfort and healing. A sitz bath is a warm, shallow bath that soaks your perineum. If you have stitches, they will dissolve on their own over a few weeks. After giving birth, your body will be going through some major adjustments. Here are some things to be mindful of. When it comes to vaginal bleeding, also called Lochia, the color will usually be dark red for the first 48 hours, followed by light bleeding for up to several weeks after birth. Your flow will be heavy intermittently. It is normal to see several small clots. If you have been lying down for several hours, you may experience a gush of blood when you first stand up. This is to be expected and is no cause for alarm. It is possible you will notice heavier bleeding 2 to 3 weeks after delivery when there is a shedding of the uterus lining where the placenta was attached. It is normal to have bleeding or vaginal discharge for up to 6 to 8 weeks after delivery. You may notice leaking of urine when coughing, laughing, or sneezing. This is normal and usually temporary. It is important to drink a lot of fluids. Drink 8 glasses of fluid a day and 13 glasses a day if you are breastfeeding. Your urine should be pale yellow. Constipation after delivery is very common. Expect a normal bowel movement by your 3rd or 4th day after delivery. To help you return to a normal pattern of bowel movements, we recommend you drink plenty of water and include high-fiber foods in your diet, such as fruits and vegetables, prune juice, bran, and whole grain breads and cereals. Take stool softeners or laxatives as directed by your healthcare provider. If you have no bowel movement by your 4th day after delivery, or you begin having concerns, contact your healthcare provider. Hemorrhoids are swollen blood vessels in the anal area. They are not uncommon in pregnancy. Symptoms may include itching, pain, and sometimes bleeding. Constipation or diarrhea can aggravate hemorrhoids. To decrease symptoms, eat a diet high in fiber. Use over-the-counter hemorrhoid cream, medication, or witch hazel pads. A sitz bath may be comforting. Clean the affected area after every bowel movement with medicated pads or baby wipes. Ask your provider about additional medications or suppositories if there is no relief of symptoms. As you transition back home, keep the following in mind. You need frequent periods of rest, and you should try to take naps whenever you can. For the first 10 days, we recommend that you concentrate on your own physical needs and the feeding of your infant. Avoid lifting anything that weighs more than your baby for 6 weeks. The housework and visitors can wait. If possible, get help with daily chores. Resume exercise slowly. Your provider will know what is safest in your own personal case. In most cases, mild to moderate exercise is recommended. No driving until you are pain-free and not taking any narcotic pain medication. We usually recommend pelvic rest for 6 weeks. Pelvic rest means no sexual intercourse, tampons, or douching. It is not recommended to have sexual intercourse until you have physically recovered from your delivery. If your vaginal bleeding has stopped and your perineum has healed, you might be ready to resume sexual intercourse if you have the desire to do so. Waiting for an examination by a healthcare provider to make sure the vaginal area is healed is recommended. Vaginal dryness and pain is common after delivery. Lubricants can help. Schedule your postpartum follow-up appointment with your provider for approximately 6 weeks after delivery. Having a newborn is an exciting but often overwhelming time, especially for new parents. Make sure to lean on family, friends, caregivers, or community support groups. Most of the changes you'll notice in your body are totally normal and you will adjust in due time. But please call your healthcare provider if you have any of the following: the chills or a fever over 100.4 degrees Fahrenheit, difficulty or pain when you urinate, urinating frequently with only small amounts of urine each time, heavy, bright red bleeding saturating more than 2 pads per hour for 2 hours in a row, fainting episodes, redness or severe pain in the breast area, if you notice blood or pus coming out of your nipples, pain, tenderness, redness or swelling in your calves or thighs, if you require an increased amount of pain medication with time, or if you feel you might have postpartum depression. Thank you so much for choosing UCLA Health during this wonderful and momentous time in your life. Please don't hesitate to contact us if you have any other questions or concerns.